Thank you. It was a great panel. So really excited to be here. Thank you to the Emids team for having us. I think what we're going to do is kind of dig in a little bit more, building off of the last conversation, to talk about the reality of consumer experience, personalization in healthcare. There's a ton of excitement, as you clearly heard. There's a lot of atypical players, as well as folks that have been in the industry a long time talking about consumer experience. But when we think about the strides other sectors have had, even regulated sectors like financial services, healthcare is still lagging behind. And so we're going to spend some time today unpacking why that is and really talk about how organizations in healthcare can embrace the consumer. So we're going to go ahead and dig in. I think the first place to start is let's define consumer experience and good consumer experience. When we think about healthcare, I know we've probably all played buzzword bingo, and so let's just talk about what's the reality and sort of, kind of differentiate between buzzwords. But Sid, maybe I'll pass it on over to you.
Yeah, hi everyone. My name is Sid. I'm co-founder and CEO at TruePill. And so when we think about consumerization, we look at it from the context of the pharmacy space. And a little bit about us, we power pharmacy experiences for our clients, and we do this by connecting the digital pharmacy experience with the actual physical fulfillment that we run across all 50 states. And we do this for many of the brands that you may have seen over the last 5 years emerge. Companies like a Hims & Hers, a GoodRx, a Mark Cuban at Cost Plus Drugs, as well as the leading innovators or players like an Optum as well. And what we've seen through the last 5 years is pharmacy has actually lagged behind some of the other parts of healthcare. And you go down to the building blocks of why that is, and we're in 2022, and when you think about a modern consumer or e-commerce experience, there's a couple things that are pretty basic when you're thinking about powering a pharmacy experience. You have to tell your patient what the price of your drug is, and you have to tell them where your product is or package is in the life cycle of the delivery. And those two things are actually quite difficult for the existing pharmacy infrastructure. And so that's what we do. We power it white labeled for many of our clients. And so for us, it's some of the basic elements of what we see every single day in e-commerce experiences that we use on our phones to online. And bringing some of those elements into the pharmacy space is where we're focused, and a lot of work still left to do there. So.
Yeah, perfect. Alan?
Well, morning, everyone. That's when you guys respond. Good morning. There we go. First of all, it's great to be here. What a great town. I actually get to dress the way I normally dress and not feel weird about it. So, I'm the president and CEO of Empire Blue Cross Blue Shield, an Elevance health company, and that's Elevate and Advance, hence Elevance, just in case anyone's confused by that. From my perspective, when I think about customer experience, not just at Empire Blue Cross Blue Shield, but I had actually started a health insurance company a number of years ago with a very large provider in New York called Care Connect. And one of the fundamental concepts of that was customer service. Why? Well, if we think about the customer experience in healthcare, and we think about why a consumer called a health insurance company 15, 20 years ago, it was, I don't understand my benefits, I need to find a doctor, why isn't my claim paying? Guess what the top three reasons for calling a health insurance company today are? I don't understand my benefits, I need to find a doctor, and why isn't my claim paying? So from my perspective, when we think about the consumer experience, we still need to think about the actual interplay we have with the consumer. Right? We have our own language in healthcare, right? EOBs, deductibles, co-insurance, in-network, out-of-network, medical necessity, I could go on. And we put the pressure on the patient when they're sick. And I guarantee one thing, everyone in this room has been sick. The last thing you want to do is figure out your health insurance coverage. And so for me, I think the ability to get real data, real hyper-personalization to that member in advance and guide them through their journey, that's how we have real customer service at point of care so that we can begin moving forward as an industry.
Perfect.
Morning. So I'm Josh, CEO of Season. We're a food as medicine platform. We aggregate all of the necessary parts to make food prescribable and certainly personalized to the member. It's pretty core to the way we think about why food is important. I built a consumer food business before this, and I'm trying to translate a lot of that into healthcare and learning this new language and all of the various sort of complexities to it. But I look at the way that, in particular, food is currently delivered, both in the sort of literal sense and in the healthcare sense of that, and it's couldn't be less personalized. Post-discharge meals tend to be, here's this benefit, take it or leave it, if you know about it, which many members don't seem to. There's one option, one vendor, certainly, within which there's very limited choice. It's probably not culturally relevant. It's probably not for your whole family. It's very one-size-fits-all. And I think the food is, in some ways, the beginning or the ending or both, but to the patient journey around the whole sort of, the whole benefit needs to be personalized more. And we'll talk more about that, but it's certainly eye-opening to see how it's being done today.
Yeah, no, it's great. And I think when we think about this, so obviously we all want a great consumer experience. We see that in every other facet of our life. Why do we think healthcare is so far behind? Maybe Alan, I'll start with you.
Yeah, no, I appreciate you throwing that one at me. Well, I would say this. We come from an industry that wasn't designed, right? I mean, it's grown and it's evolved based on whether it's regulation or market opportunity or even deregulation in some parts. And so it's not like we're turning around and saying, okay, healthcare should look like this, right? Healthcare looks the way it does for many, many reasons. And so from my perspective, it's about how we then take this in this industry, which, if you think about it, I'll just say for the record, I believe this is the greatest healthcare system in the world. Yes, it's expensive. Yes, it doesn't work for everyone. But I also grew up in the UK, and the National Health Service, nationalized healthcare is not utopia. And I have many stories, which I'm happy to share at the right time, about why that is. In this country, we have an incredible healthcare system. We have incredible hospitals, we have incredible doctors, and we actually have incredible access. The question from my perspective is, why hasn't it connected up to this point? And I think part of that is trust, right? We have what I think are really important intermediaries, such as health insurance companies, right? Which, just for the record, are not just payers, right? We actually are the hub of all of the data. Right, so we have the ability to coordinate data across an entire patient's journey, but we don't yet have the trust of all the parties within our industry in order to connect that data and use it for the right thing. And so we were talking just before, the technology exists, right? We can all go out there and find the technology for the solutions. The issue is, I believe, we don't quite have the trust or the right connection points for us to deploy that technology in a way that will make for a better experience. So what is the ultimate goal of the technology, right? To give a physician and a patient all of the information at the right time so together they can make the best decisions on a course of treatment. But we haven't done that, which to me I think is borderline criminal, right? It should be public health policy, right, whether at the state level or federal level, in order to put that information in the hands of a physician and a member. And so to me, that's been the gap thus far.
Yeah, no, it's an interesting perspective, and just kind of from the seat that I'm in now. So I joined LifePoint in February. I've been on the tech side my entire career. So Amazon, Google, GE, was at Walgreens, and now I'm on the delivery side, and kind of being able to see the different way that innovators from Silicon Valley and sort of pure tech folks come at a problem, and then folks on the ground, they speak completely different languages. So I joke that I'm the chief translation officer, which is why I think this panel and the expertise that's up here on stage is really interesting. Because Sid, we were just talking, you've sold companies to LinkedIn. You've been like as consumer gets. And so what really drew you into healthcare to try and take a shot at fixing this, given, the points that Alan just said? There's so much opportunity, but it is really hard to change the way that the ingrained system sort of is set up.
Yeah, it's. I like to say you're not building autonomous vehicles in healthcare. You just have to build a decent experience that takes a patient from point A to point B So you don't have to be the best technologist, the best product person in the world. You just have to be able to build a decent web experience. And so the bar was quite low. So when I looked at it and learned about the space, I said, well, I can bring everything I've learned from a consumer background and bring it into healthcare. But then going back to even the earlier question on sort of what are some of the systemic reasons why we haven't seen adoption, I bring sort of an outsider perspective. I've only spent the last 5 or 6 years in healthcare, and you have to start to understand especially in the pharmacy world, the underpinnings of how the industry works. And so you're learning the industry for the very first time, and I look at it objectively and say, imagine a business model where you don't have to innovate, you don't have to build digital experiences that delight consumers, yet you can capture 20% of the profit pool of all of pharmacy. And I think that's the way, whether right or wrong, we don't have to debate it today, that's how the PBM industry has been designed. And then you look at the interactions with drug manufacturers and how they work with PBMs, and there's reasons why we haven't seen innovation there. But I think over the last 5 to 7 years, especially, and through the acceleration of COVID, what we've seen is the models are getting disrupted from all angles. You're starting to see the direct-to-consumer health brands, like a Mark Cuban, for example, start to disrupt with a 100% cash pay model. You're starting to see the likes of Optum and Optum Store re-innovate their pharmacy experience. You're starting to see drug manufacturers and top-tier pharma clients think about how they go direct-to-patient to potentially circumvent a wholesaler or the PBM itself. And so I think that's where the innovation now is, I think, unavoidable. You're starting to see the shift is happening. Everyone is trying to claim their turf on what their go-to-market strategies will look like, and I think it's going to be a really fun next five years.
Exactly. And then, Josh, you mentioned when we were chatting in preparation for this that, healthcare is just really hard, right? It should be simple. Would love your thoughts on, what you're seeing and why you think that folks are lagging behind in the industry.
I think the biggest observation I have coming from the consumer world is in terms of why things are behind, and it does seem to just be behind. I mean, I don't know that hard is necessarily the word. I mean, everybody says that. Everyone tells me that every day. It just seems behind, and the biggest thing that I see is really cycle time. It's, Sid sort of mentions these new models that are happening in healthcare that happened in the consumer world that we all live in 10, 20 years ago, and it just sort of strikes me that everything takes longer. You build a new consumer business, or even for that matter, an Amazon product, and the feedback loops are, measured in seconds. We're going to put up this image for this person because they came from that site. We know something about them. In the food world, we're going to not show meat to a vegetarian, and so on and so forth. And that's going to drive conversion rates. And there's, at this point, it's a buzzword, but there's probably some machine learning in the background. And that happens, and you turn around after a day, a week, a month, a year, and the experience is just personalized. There are proper reinforcement loops in place that seem difficult, if not impossible, to build in healthcare. The plan's got to approve every message. Months of lead time. You compare that to literal, we're measuring sort of conversion rates in milliseconds on the consumer side versus literal months to approve a different iteration of the message, and then everyone wonders why it's behind. So that sort of cycle time, and that's a trivial example, but that's the piece that stands out the most to me in terms of why, the best-in-class experiences that we all experience and expect from the consumer products we all buy seem to be years behind in this industry.
Yeah, no, that's actually really good. That just brought me way back to my early AWS days. We were meeting with a bunch of pharma companies, and they're like, we understand the value proposition of cloud computing. We want to do this, but what are we supposed to tell the FDA when they come audit us? And what we're used to saying is, that's the server that we did that trial on. It has dust on it, but there's the barcode. We updated our systems every 3 seconds. So to go from here's a server in a corner covered in dust to the technology allows you to update every 3 seconds with a trail, how do you explain to the person coming and auditing you that this is safe and secure? So I think those are a lot of the hurdles and kind of that chasm that we have to cross as an industry coming together. So speaking of that, let's dig into the tech piece, because this is sort of, I think, one of the big pieces where there is a bit of a disconnect. When we think about personalization, and would also love to hear from, especially Sid, from your perspective, personalized experience, you need data on a person. We can argue how much data you need for what you're trying to accomplish, but whenever we talk about, I'm a lawyer by background as well, so I always have to like disclose that. Normally gets a little bit of a chuckle, but when we talk about data and capturing data on people in healthcare, people shudder a little bit, like, ooh, get really uncomfortable. Alarm bells really start to go off. So, and then you layer that with the fact that traditional healthcare is mostly run on outdated technology with silos. So the data doesn't speak to one another. It's in very different languages. I get pitched all the time on FHIR and value-based care, and I would say I would love for all of my data to be FHIR compatible and for everyone in healthcare to be in value-based care. It's just not the reality on the ground. How do we start to address those realities so we can bring not only the data that exists in healthcare that's very valuable in the EMR, in the other systems of record, but also start to think about new sources of data. When we think about wearable information, we think about shopping information, we think about consumer-generated data. How do we start to bring all of that together, given the realities of the bad tech systems out there, to offer these seamless, personalized experiences? Because that, I think, is going to be one of the biggest hurdles for us to overcome as an industry.
Yeah, I would say when I look at this from a consumer experience standpoint, I always think about experience from on a spectrum. And on the one end of the spectrum is just bare minimum viable product and consumer experience. On the other end of the spectrum is personalization or intent. And actually personalization and intent are some of the hardest problems to solve from a e-commerce or computer science standpoint. And I think that jumping into that before ensuring that you have like a solid foundation of how do you take the patient from point A to point B, I think can work in certain parts of the healthcare stack. I can tell you from the pharmacy world, it won't work. Because today, when you look at adoption of digital, it's about 1%. When you look at mail order adoption, in pharmacy, it's about 9%. And so you contrast that with other industries that have seen penetration from consumer, use an industry like groceries, for example, which is at 12, 13%. And I think you can use common sense to convince ourselves that delivering perishable goods is a lot more complicated than a pill that's going in the mail every 30 or 90 days. And so I think specifically in the context of pharmacy, we still have a lot of work to do to get the underlying infrastructure transformed to then be able to solve the really fun problems that you described on intent and personalization, on if you're taking this medication, here's what else you might be dealing with. And I think we're starting to see that develop. As we spend a lot of time integrating directly with many of the large PBMs, you're starting to see how they're evolving the level of transparency you can provide to a digital front end. Because we come to them and we say, here's what the consumer experience needs to do. These are the basic features that it needs. We need the pipes from you guys to support that experience. And you're starting to see that at a very basic level now start to take shape. And I think then the really fun things start on figuring out intent and figuring out how to personalize the experience. Yeah. And so that's where I would say we're still in the early days of pharmacy transformation on the infrastructure side.
Perfect. And then on the insurance side.
On the insurance side, yeah. This one's complicated for me only because I think we jump to, we talk about, which I mentioned before, EMR bidirectional data, right? I think we can all agree that philosophically that has to be the way forward. And we can talk about the fact that, there's more data on my wrist with my Apple Watch, and I've given more permissions to Apple than I probably have to my insurance company, or to my physician for that matter. But as I think about the real data that is going to make a difference in people's lives, right? At Empire, we set a mission a few years ago that we were going to measurably and materially improve the health of every single New Yorker, regardless of whether or not they're our member or not, right? And why? Well, number one, from my perspective, if we don't do it, who will, right? Because if you think about the healthcare industry, it is very defragmented. So there has to be some sort of universal pulling together of it. And that's where I think the insurance companies really have a role to play. And yet, when we really get into the data, what we're missing is that incredibly local cultural understanding of our population, right? So if I happen to be within, let's say, 70 miles of New York City, every zip code, every couple of blocks is a completely different way of accessing care. Not because the physicians are different or the hospitals are different, but the way people consume healthcare and use healthcare is different. We launched what I thought was an incredible program a few years ago called the ABCDs of Healthcare. It was just a really simple way of getting people to understand the impact of asthma, blood, which was really the whole circulatory system, cancer, and diabetes. In our mind, those were real drivers of kind of social impacts of healthcare within those communities. And it could translate, right? Everyone understands ABCDs. Well, that's not actually true, right? Because if you're in Flushing, they use a completely different system of alphabet. And so while we thought we were really capturing data and going out there and being able to coordinate care, it turns out massive swaths of our population don't actually work with us that way. So from my perspective, it's not just about capturing data, it's about being able to translate it into the way healthcare is consumed and used in each of our communities. That, to me, is the next stage of using the data in order to improve people's healthcare. And at the very end of the last panel, he asked, who's going to win in health in our industry? I actually think private equity is going to win, right? I mean, usually they do. But why?
Good for those guys to get a win.
Exactly, right? Why? Because I think they're the ones who are really driving some of this innovation in these areas that, quite frankly, large insurance companies, large providers, we have too much to deal with what we're doing today. And so I think there's a huge opportunity to get that cultural data and to make it actionable.
I laughed that you said that. We're actually owned by a private equity firm, and I will say this, Apollo owns us, extremely supportive of really helping us weather the storm that's going on right now in our economy, in the healthcare industry, and really thinking about growing for the future. And I was very fortunate to get to experience this when I was at Amazon. Everyone talks about Jeff Bezos in the early days saying, oh, I'm just going to reinvest all the profits for growth. And we see what a wonderful, large business that has become. That is not something that is afforded to most of traditional healthcare, which is really unfortunate when you think about the impact we can each have in the lives of our friends and our neighbors and our family members, because we don't have a large ads business or we don't have a cloud computing business. And again, I'm the biggest fan of these big technology companies, but I think that that's one of the differences when we think about on-the-ground healthcare. And so your mention of private equity, they've been able to give us a little bit of that, which has been really exciting to help us really push forward. So, but Josh, anything you want to add on the technology piece and data that you're seeing and sort of how we can overcome some of those hurdles?
Sure. So I actually think that there's a big opportunity, and no surprise, I'm bullish on the food space, but for any of the folks that are working in or around the more, for lack of a better term, lifestyle or SDOH kind of areas, because a lot of that data is not necessarily PHI in the same way that the sort of clinically oriented data is. And it matters a lot to know who's in your household. What kind of food does your spouse like? Do your kids like? Where do you live? What's the climate outside? Let's not, recommend grill recipes to you in the middle of the winter in Minnesota. That kind of data, your budget, your lifestyle, how many times per week do you want to cook? And it's obviously food specific, but that turns out to matter a tremendous amount for, adherence or compliance or how you want to think about it. But in consumer language, it's just, what do you like? What's, sort of product market fit? What's appealing to you? How do we, sell you more food? We don't sell the food, but get you to eat it. And none of that is, classified by the lawyers, I think, as PHI. And so there's an opportunity there to actually use that in personalizing the experience in a way that is less encumbered by the sort of siloed issue. And it doesn't need to go into an EHR. There's probably a place for it there, but there's an opportunity there. So it's actually
great.
an optimistic view.
So we talk about technology. Everyone in this room knows that's a huge hurdle. One that I would argue is probably a bigger hurdle is behavior change. So when we think about it, the technology exists. There's money out there that's being invested in healthcare. I often say this sort of analogy. You can have the best technology out there, and I think yesterday Jared mentioned it, distribution is really important. So distribution's great, but also how do you make something that people want to use? So when you think about healthcare, it's often described as a grudge purchase, which is basically means people are not excited to engage in it. And while I was at Google, we actually did some studies to try and find where are some moments where people actually enjoy engaging with healthcare. And it was really, really quite sad. We only really found one. And again, this could skew very much the other way, but generally speaking, when someone's starting to try, or someone's starting a family, so pregnancy journey, things of that nature, people are very engaged in their healthcare, and they're excited about what's to come. So knowing how hard behavior change is generally, as well as for the fact that most people, healthcare is an afterthought for them. It's, I'm sick, I need care now, but they're not like preventative in sort of their thinking and their daily habits. How do you guys think we can shift this perspective? Because if we figure out the tech, if we get the funding, we still have to get people to change their behavior to actually, I think, see some of the fruits of all of this labor come to bear. But maybe, Josh, I might start with you.
Sure. So I got a different point of view on this, I think. I don't actually think behavior change is that hard. I think the way that people frame it up is hard. If you ask someone to do something they don't want to do, it's very hard. It's
Fair.
almost impossible. I think, pick your favorite big tech company. We've all changed our behaviors immensely in the past years and decades. Mm-hmm. The way that we do everything is changed now, and nobody made you do that. Nobody makes you use Uber or Amazon or on and on and on. We do it because it's easy. It's a good experience. It helps you, and I think that it's obvious, but the sort of path of least resistance is what we all do, and it gets framed as laziness. And I don't think it's what it is. I think we all do it because we're all busy, and the cognitive load of doing the harder thing is high, and so building experiences that are easy, make the easy thing the right thing, it's cliche, but I think it's very true, enables behavior change in a way that doesn't feel like it's giving something up. It doesn't feel restrictive, in food terms. It doesn't need to be a diet or anything else. Like, we all eat what's around us. You eat what's in your home, your office, your neighborhood. If we change what's around you, we will change what you eat. We know that both in the consumer sense and in the clinical, rigorous RCT sense. And I don't actually think that's that hard.
Yeah, no, that's a fair point. I think that being able to show enough value to make it worth someone's while to make that change, right? You use Uber because it's raining in New York City, you got to get to that meeting. Fantastic. I will give them my data because I want to get to that meeting on time and I don't want to come with wet hair. So completely agree with you on that side. But Sid, maybe I'll go to you next.
Yeah,
get your thoughts.
When you were saying that, Josh, I was thinking about the opposite of where behavior change is actually difficult. And so I live with my in-laws, and they're getting older. And there is just about nothing I can do to get my father-in-law to take a stool test. And his primary care doctor will tell him 50 times in a span of 90 days to do it, because he actually was at risk on a previous screen, and he won't do it. And so there's psychological elements to certain people that will or won't do a certain thing from a behavior change standpoint. And then I got my mother-in-law who, if you just give her a better discount, she's on it, right? And so I think you gotta understand what the incentive is for the consumer. And I think the two things we've seen, above all else, and I think even Glenn, and I think maybe either Glenn or Mario mentioned it in the earlier panel, it's if you just lower the price of something. If you drop the incentive being the cost rather, the incentive is there then to adopt a new technology or a new solution. So I think in pharmacy, certainly the price is a variable, and that's something that you can drive down. And I think the second is convenience that we're seeing across a lot of the consumer healthcare experiences. And I think once you see convenience and price converge, that's when you'll start to see real behavior change in the masses. And certainly there are systemic reasons why price and convenience can't converge, because of who controls the price ultimately in the pharmacy space. But I think we're making progress there, and we're starting to see disruption from multiple angles, and eventually, hopefully, we see convergence.
Yeah, perfect. Now?
Well, my first reaction is sadness, because I hate being in an industry where it's considered a grudge purchase. I have to say I haven't really thought of it that way. So now I'm depressed.
We don't want you to be depressed.
No, but I think that word in of itself, there's a lot of things that we do as a society that we don't want to do. Mm-hmm. I'll tell you, I don't want to go to the gas station and fill up my car. I don't want to see that price go up. So I would consider that a grudge purchase, but I like driving. I don't want to insure that car, I'd rather not, right? I don't want to have other types of insurance, but you have to have them. And so I feel like healthcare is one of those. At the end of the day, we all need healthcare and we all need health insurance. We just don't want to deal with it because we want to. I think a lot of people go through life not wanting to get into the weeds on those types of purchases. So yes, affordability is vital. Listen, if we don't have affordable healthcare, then we really don't have an industry. From my perspective, though, I think you can get around this grudge concept through simplification. And again, I go back to, why do people call insurance companies? They don't call to say, hey, I had a great day, right? And they call because they have a problem. And for me, that purchase is about getting them to neutral on that first phone call. If you get somebody to neutral, you generally can have them leave happier from the experience. And so, whether it's networks, when I joined Empire Blue Cross Blue Shield, I think we had like a dozen different networks, right? And in some of our networks, we had the hospitals participating, but the physicians in the hospital weren't participating. That would be a grudge purchase, right? That just is, I cannot believe that we thought that was a good idea at some point. Now we've simplified it. So now you have a choice of 3 networks. They're concentric. So you can have the big PPO network. Guess what? It's going to cost you more. You can have a middle tier network, which we call Blue Access. It's going to cost you a little bit less, and you generally have a lot of choice. And then we have this connection network, which is our relatively smallest network, but it's about 15% less than our big network. That's really simple. When you go onto our website to look for a doctor, you just need to know you're in one of these 3 networks, and we price the products up and down the slope. And we can turn around to an employer, which is still the largest purchaser of healthcare, and we can say, you can have any benefit design you want, and you can have it across those 3 networks. So you can go to your employees, and you can vary their contribution per check in order to educate them on what fits them. It has been an incredible change, behavior change, in the way people are looking at our organization now. So for me, I think we acknowledge it's a grudge purchase, but there's a lot of grudge purchases out there. Mm-hmm. We get to affordability, yes, but simplicity. People don't want to deal with it, so get it as simple as you possibly can.
Yeah, and I think one of the things that's really interesting is because healthcare is so complex, data's all over the place, a lot of times, it's in a language that people do not understand. They don't feel equipped to ask the right questions. And so when you don't feel comfortable with even just a pure baseline, it's really hard to make a move one way or another. And so I think, what's exciting to me is you're seeing lots of different entrants, people that have been in healthcare for a long time, folks that are coming from the consumer world that actually want to make a difference. And that's what's really fun about being in healthcare at this point in time. So I'm optimistic, maybe foolishly, but I think we're going to get there. So each of you have successfully navigated many of these hurdles. And I'm just kind of curious, if you have any tips for the audience. So hopefully we can all leave with something as to what we can bring back to our organization when we think about making consumer experience real in healthcare and the ability to, as Sid mentioned, over time, really, truly personalize it. But anything you guys might add, and maybe Alan, I'll start with you.
I love this question. So I get asked this question a lot, I think both personally and for the industry. For me, what really gets me excited about this is the passion, right? So I personally have navigated, I'm in a role where I lead people, and I lead leaders, right? So from my perspective, what we need in healthcare in order to get over the barriers is leaders. And what does that mean? That means people who really care. Right? Because this is a complex industry. We've talked about that. You got to really care about something. There's no blueprint in someone's corner office that says, well, hey, we're really bad at connectivity. Let's just pull the blueprint out and we'll use it. That doesn't exist. And so I often say to people, our biggest challenge in healthcare is the status quo. We cannot be comfortable with what we have today. And so if you're in this room and you want to take something away, take away the fact that status quo sucks. Right? It does. And if you really want to make a difference, thank you.
We need a bumper sticker.
Status quo sucks
bumper sticker.
in healthcare. If you really want to make a difference, just walk away with that. The opportunity is incredible in this industry. You just got to grab it and have some faith that you're going to make a difference. And so I get up every single day and I say that to people. I walk into the offices. I don't even have offices. We got rid of offices in my building. Why? Because make people energized. Get people to this conference. Get people less hungover. And really make a a difference. So for me, that's what gets out.
No judgment.
No judgment at all. No Jaeger shots.
Perfect. So maybe I'll go to you next.
Yeah. I think it depends on certainly the audience that you're talking to, but if you're entering the healthcare market as a disruptor, as a new startup, that's probably a little bit different than if you're a healthcare leader. And the common advice I'll share with anyone entering the healthcare space or a new startup is just stay alive for the first 5 years. Just don't die.
Don't die. That's another good bumper
There's
sticker.
many people that will try to kill you along the way,
Yeah.
and it's not always the best product that wins in the market,
Yeah.
which is often the fallacy if you're coming in from a technology product background. It's like, my product is great, why doesn't it win? Well, you have to navigate all the landmines and stay alive for your first 5 years. And then from there, I think, then the opportunities, you'll really start to see what the potential of what you're building and what you're pursuing are. And I think today, I agree with you, I'm completely optimistic that because you're seeing the disruption from so many different parts of healthcare. We talked about the payers, you talked about consumer health brands, we talked about life sciences companies. We're seeing it from every single aspect of healthcare. And I think the result of that is maybe for the first time ever that the consumer actually wins. And it's not about profits and dollars for every single stakeholder. They'll make their money along the way, but the consumer actually gets a better experience for the first time. So I'm very optimistic that we're right at the cusp of that, and we've seen all the things you can do even through COVID as many business models were disrupted and changed. And so that's what leaves me very optimistic about the next phase of consumer-driven healthcare.
That's awesome. And no pressure, but you also need a bumper sticker saying, so we have 3 of them.
Don't die.
I think I'm taking Alan's.
What do you got?
Which I agree. I think it's actually an optimistic thing. You know, the status quo is so bad, and there's so much opportunity in the form of, I don't know, I think we talk about internally is only very recently did the high-risk patients or members adopt a lot of this technology, right? The sort of late adopters in the classic curve are the high-risk members, and they just got to where, you know, we've all been as early adopters of, you know, consumer products very recently, and that creates a tremendous opportunity. I think it actually gives us the platform to build these experiences on in ways that weren't possible until probably the pandemic, quite frankly. So I think that's actually very optimistic. It will take time. I agree. The industry is slower than, you know, hopefully everybody wants it to be. I hope everybody can agree to that. But and sometimes, you know, for good reasons. But nonetheless, the opportunity is there. Things are changing, and the sort of substrate to build these experiences on finally exists.
That's perfect. So we're going to wrap up with a last question. The last panel asked about who's going to win. I'm going to ask the panelists here, what are you most excited about when you think about what's coming in the next 5 years from a consumerization perspective in healthcare? And Sid, I'll start with you.
Yeah, I think I shared it. I think the consumer wins, right? And I think that's finally, maybe for the first time, the incentives will be aligned, and we continue to build experiences across the board that puts the consumer in control of their decisions, and even from their wallet standpoint, even from the cost of care standpoint and the choices they make, I think that's where healthcare starts to get unlocked. So I'm encouraged that we'll continue to kind of push in that direction of letting the consumer choose and benefit from the disruption we're seeing.
Perfect. Alan?
Well, I'm most excited about my new diversification into bumper stickers.
Right?
Status quo sucks, don't die. That's the first one. No, I just think that there's so much opportunity out there. I do think that the consumer is going to be kind of at the center of it. I will be contentious and say I don't think the consumer is going to be truly capable of making their own decisions on this. I think it's completely overwhelming. And so I think the future is about guiding them and being able to give them the right paths versus saying, here's everything you need, here's everything, good luck. And I think that when HSAs came out, that was kind of the theory. Hey, you guys will figure it out, you're smart. And it didn't really happen. So I'm really excited about seeing all these components, this data coming together in order to influence the consumer down their care journey. And that a consumer, or I'd say my wife's number one source of choosing a doctor is Facebook. She goes on and she says, hey, does anyone know the best pediatric whatever? That we need to get to a point where we're guiding somebody to a point where it's actually making an impact in the most positive way. So I'm really excited for it.
Perfect. Josh?
Yeah, so give you the food example. I think in terms of what I'm most excited about is a continuation of the last thought, which is the sort of foundation is there finally. every food business that survived COVID has a digital ordering and delivery platform now. Every single one. You didn't survive the pandemic without it. Consumers, patients, including Medicare, Medicaid, high-risk folks, are ordering food online. They had to. You had to learn during the pandemic to get grocery delivery. And a lot of that behavior has been pretty sticky. Telehealth. The components are there, I think, to finally really shape food environments, which is the mission we're on, which I think you shape the food environment and the behavior follows. If you change what's around folks, like we're all going to eat what's in this at the conference today because it's here, you change that, the behavior does follow, and I think that's very exciting.
Perfect. Well, I want to thank the panelists, and again, thanks to the Emids team for having us. Enjoyed the conversation today. Thanks, guys.
Okay.